especially my young colleagues. A very warm greeting from Infection Control Academy of India. The colleagues, senior colleagues who are sitting from IMA and our Deputy Drug Controller, Ramkishanji, and the organizers. Thank you very much for giving this opportunity in order to bring out some spotlight onto an issue of not only national concern, but a global concern. That is about antibiotics. Antibiotics, today my topic would be to talk about the use, the misuse, the resistance, and also the containment of that resistance in order to ensure that we are going to have these magic bullets available for the future generations. When antibiotics were invented, everybody talked about them as magic bullets. I am sure most of my senior friends would know, but for the young generation to know, they were considered as magic bullets. So today, before I start on my presentation, maybe you can see on the screen, you can see a beautiful hero and also a beautiful villain also. When it comes to antibiotics, what do you think? Are the antibiotics the villains or the heroes? I don't see any of you actually responding. I see most of you are busy with your mobile phones and chatting with each other. If you could give me 20 minutes of your attention, I would be really grateful, and you would be grateful for your future practice, because most of you are medical students. I am sure knowing a little bit more about the antibiotics is definitely going to serve your future patients in a better way than what we are doing in our generation. So we'll come back to this slide a little later. But since most of the participants today are the young future medicos, let me give a little bit of brush up on a few terminologies which we frequently use about the antibiotics. What is, first of all, antimicrobial? Antimicrobial is any agent which is capable to perform against any microorganism. That is what actually antimicrobial is. It could be the antibiotic, it could be the antiviral, it could be the antifungal, anti-malarial, anti-parasitic, etc., etc. They can be produced biologically by microorganisms, or they can be produced by other synthetic process by the chemists. Ramkishanji has given a detailed note on how the pharmaceuticals, when we talk about pharmaceuticals, they are predominantly the chemical products which are synthesized in the labs. So they can be broadly two kinds. Either they kill microorganisms, then we call it as bactericidal or microbicidal. When they are able to just inhibit the growth, we call them as static or bacteriostatic or microstatic. Then comes to the question of antibiotics. When we talk about antibiotics, it is a type of substance against purely bacteria. That means it doesn't act against any other microorganism like virus, the fungi, etc., etc. Clinically effective antimicrobial agents, they usually work by mechanisms that inhibit essential processes in bacteria, unlike antiseptics, because antiseptics, they don't have a very specific target, and hence when you are using antiseptics, you usually have very high level of toxicity, and hence they are not usable for most of the purposes. What are the main types? They are broad spectrum antibiotics, which means they have the activity against both gram-negative and also gram-positive species, or the narrow spectrum drugs, which is becoming very essential nowadays. Why, I will come to that a little later, has activity against only one group of microorganisms or only one species of microorganisms. Then comes another very important thing is therapeutic index. What does it mean? It means a level of selective toxicity of a given drug comparing to the blood concentration at which a drug can give the therapeutic effect. That is what is therapeutic index. So with this, probably we have set the tone. Now let us understand what is the classification of these antimicrobials. They are predominantly given by their action. They can act on the cell wall. They can also inhibit the cytoplasmic membrane. They can inhibit the protein synthesis. They can inhibit nucleic acid synthesis, or they can also actually act on the metabolites or the antimetabolites. That is how broadly by their action they are being actually defined and classified. They can vary according to the targeted microorganisms. That is, we talked about antibiotics, antivirals, antifungals, etc., by their molecular structure, their antimicrobial mechanism, etc. So now since we have set the tone and understood the broad contours of what are the antimicrobials and antibiotics, now let us look at why do we need these antibiotics? Why do we need? That is a question we need to ask, because unless we ask this question very frequently in our practice, we are going to do missteps, which is going to be very expensive for our globe and in general for our healthcare system. Nearly half of the hospitalized patients, as you know, or probably you would know in the future, receive the antimicrobial agents. Either they are antibiotics, antivirals, etc. Antibiotics are valuable discoveries of modern medicine, and probably we cannot imagine our healthcare system, our current healthcare system, without having the antimicrobials. Because that is the kind of very important role they play in day-to-day delivery of our function as the doctors, nurses, and other healthcare workers within the healthcare ambit of the healthcare system. All current achievements in the medicine are attributed to use of antibiotics or in general antimicrobials. Probably it would not be a overstatement if we say that. And definitely the life-saving for most of the severe infections which we see within our hospitals. If we just go back into the origins of the antibiotics, it had been invented by chance, as you know. Would you know, who is this person here? I'm sure you all must know that this is Alexander Fleming, who very accidentally found out the penicillin. But when he saw actually that plate, he thought and he perceived that a fungal contamination of agar plate with Penicillium rubens inhibited the growth of bacteria. But then, of course, later on, everybody realized in itself it has got a potency that, to kind of inhibit, not only inhibit the growth, but also to kill the microorganisms. The antibiotics, as we all know, are the natural substances produced by microorganisms. That is one type. They can be the penicillins or the tetracyclines, which are not really much in use nowadays, but they used to be the main products, about 2 to 3 decades back. And then semi-synthetic antibiotics, which are kind of modified natural products. They are amoxicillin, doxycycline, etc. Then there are pure synthetic antibacterial agents which are chemically synthesized. Probably you would all know is ciprofloxacin or any other fluoroquinolin for that matter. The working of the antibiotics, they work by very selectively acting on bacteria, or they bind to target molecules present in bacteria, binding to target to inhibit essential cell functions, which we talked about in the earlier slides. And of course, along with these effects which it produces, that is either being a bactericidal or bacteriostatic, they also produce a lot of side effects based on which product. For example, the kanamycin kind of products, which is an aminoglycoside, can have the impact like hearing loss, kidney damage, etc., etc. I would not go through this slide because it is a universe of all antibiotics and antimicrobials which are currently available. These are all the classes and the targets. Probably I will leave the presentation with the organizers, whoever wants actually, they can access it. You can go through each of those antimicrobials and the antibiotics, what are the classes and how to actually, which is the structure within the microorganism they target in order to achieve the intended therapeutic effect. So now what went wrong with these antibiotics? We talked about them being as silver bullets, life saviors, or multiple other names what we gave. But what went wrong? One is we have started taking them for granted and started treating even the trivial infections like kitch in the gully, that a slight sore throat, we immediately go to the medical shop and buy amoxicillin. If it is only to that extent, it is okay. Even our own brethren within the medical fraternity, they indiscriminately kind of prescribe antibiotics for even viral infections where there is no place for the antibiotics. Many use antibiotics without knowing the basic principles of antibiotic therapy. Again, if it is a lay person who doesn't know, that is okay, but we as the medical professionals, if we are not going to know the basic principles and start prescribing indiscriminately, that is going to bring us into a catastrophe, which I am going to talk in further slides. Many medical practitioners are under pressure for short-term solutions. Many of the doctors, when we talk in private, they keep saying, what to do. The patient has come and they started demanding actually the antibiotics. Yes, that is the reality. But I think, with a lot of patients, I think, we should take up the role of a teacher or a propagator in order to educate the patients so that, they don't demand antibiotics or they don't actually push you to prescribe something which is going to be detrimental in the long run, not only for the given patient, but also for the society and the community at large. And of course, one of the other factors is the commercial interest. We all know very well that the pharmaceutical companies have got their own targets. They want to achieve their financial targets, and they try and create an environment where they are going to push for the higher number of prescriptions by each of us as doctors. Then the poverty is another factor which also made antibiotics go wrong. Why poverty? Where does it come from? Very simple, that when there is a daily wage laborer, he or she would like to go back to the work as soon as possible. That means they would like to get the treatment instantaneously so that they can recover very fast from that infection and go back to their work so that they don't lose their daily wage or their livelihood. So now we have talked about the good part of it, and also we talked about what are the mechanisms, etc., etc. Now with the intended effect, that is the therapeutic effect, we also have intended effect, that is the resistance which has formed over a period of time for all these antibacterials, antimicrobials, antibiotics, etc., etc. So very briefly, what is antimicrobial resistance? It is the ability of the microorganism, like every living being, it also wants to survive and also to grow. And hence, they would try to do every trick possible under their hood in order to survive and find a way in the presence of that chemical or a drug, how to survive and also to produce the progeny. that is very natural. It is either human being or a microorganism, any living being would do that. What is the impact? Impact is understandable that, it makes our life very, very difficult to treat the infections which otherwise we would have been able to treat with all these arsenal of antimicrobials, antibiotics, etc., etc. And in most cases, what we see is now the age-old infections like gonorrhea, tuberculosis, etc., which we used to treat with very simple antibiotics, we are unable to treat them with even advanced antibiotics because of this bacterial resistance. Why this phenomena called antimicrobial resistance happens, or why does it develop? I think we spoke about it very briefly, but I would repeat for the sake of understanding once again that while the microbes are going to evolve constantly and survive the difficult conditions by adapting to new environments, they definitely get used to those chemicals which you introduce as antibiotics, and hence actually the AMR develops over a period of time. And considering this fact, World Health Organization has put up a list of essential medicines. I am now again going into the territory of Ramkishanji. The essential medical list is predominantly prepared by the pharmacists. And World Health Organization has, in 1977 itself, has prepared the first list of essential medicines where the antibiotics have found their own place. And that had been in revision every 2 years. The last one was done in 2021, and that list contains almost like 37 antibiotics which are considered as essential in treating 26 common and severe clinical infections, predominantly focusing on low and medium income countries, because these are the countries where we need to have a large arsenal of antibiotics which are going to be available, because by the nature of these countries where the resources are very limited and the poor settings create a breeding ground for all kinds of infections, you need to have these essential medicines available all the time. And when WHO understood actually the magnitude of the problem, they have divided the available antibiotics into 3 different sectors. One is the access, the watch, and reserve categories, so that you don't use all of them at once. It is like in the war, you don't use the Brahmastra in the beginning itself. You would keep your Brahmastra to be used in the end when all other things are going to be not working, right? It is the same way that initially you had to use small weapons, then medium-sized weapons, then you are going to go into nuclear weapons or the Brahmastras. And the reserve group is like your Brahmastra group, where you are going to use them only when all other things are going to fail, or you are going to keep them reserved so that you can tackle with the infections in a right way. This is what is the AWARE classification. I would not read through them, but in kind of essence of it, I already have given. Access is, which is going to be the list of antibiotics which are going to be available for every healthcare worker. That is, either it is a physician, in some countries actually the pharmacist to prescribe, in some countries even the nurses actually have the access to the access, and also they do prescribe some of the antibiotics, and this is available broadly. And then you have got a watch group. That means if you don't have intended therapeutic effect from the access group, then you shift into the watch group, and when the watch group fails, then you will go into the reserve group. Let me actually not go into the detail of it, but if you talk about, let's say, reserve group, that is the penems like aztreonam and colistin, linezolid, etc., or tigecycline, these are the things which are reserved. But unfortunately, in Indian scenario, even in villages, the so-called RMPs, they start with these kind of antibiotics, which makes actually life very difficult when they are referred and they come to the tertiary or secondary care hospitals to treat those infections, because you have put all your brahmastras already. You don't have anything available in order to treat these patients. So that is where the question of IMA, always comes. IMA keeps saying that, regulate these people, because they don't know what they are actually using. They don't understand actually the mechanism of these antibiotics, and they are using or misusing, which is making the state's healthcare or the national healthcare, putting that into jeopardy and the danger. That is the reason why IMA keeps actually talking about the quacks. It is not because of the jealousy they have. Most of the times the people say that, it is the professional jealousy, that's why they are attacking them. No. It is the question of actually using the right products for the right person in the right dosage, so that you can save those lives and keep them well. That is the reason, the IMA keeps fighting for it. And when it comes to this antibiotic problem, one of the things, which definitely need to be mentioned is, it is not only about the quacks. Even the practitioners who are registered medical practitioners with the medical council, they also do mistakes in terms of actually identifying the actual need for antibiotic. Does actually antibiotic needed in every case when you are prescribing? The international studies and also the national studies show that there is a disbalance between them. Disbalance between the usage and also the actual need. That is what actually is again producing kind of unintended effect on the whole of the healthcare, and the solution is to reduce the antibiotic usage on one side, and the other side to align reduced usage with the actual need. So, just to illustrate the pattern, it is not only about actually usage within the human sector. Antibiotics, probably as you would know, is very widely used in the animal sector. It is used in the agri. It is used, in other areas, including, let's say, fish farming, the aqua farming, etc., etc. So, when we broadly look at actually the antimicrobial consumption, 50% if it is human consumption, 50% would be the animal consumption. Within the human consumption, only 20% are being used within the hospitals. Only 20%. Means if you take number of prescriptions, every fifth prescription is antibiotic, and that is given in hospital. All other four, the users, they take the decision on their own and use it in the community, which is again becoming a problem. That is what is the question which was posed to Dr. Ramkishan, that how do you regulate the over-the-counter dispensing of these antibiotics, so that we don't see this kind of scenario where 80% of these very valuable drugs are being misused at the community level. And 20 to 50% of them, as per the international studies, are unnecessary. Unnecessary. That means they are being given just like that. So, which if it has no unintended effect, then it's okay. But they are not, lollipops just to take it, or they are not, eclairs or, Cadbury chocolates just to pop them just like that. And if you look at the animal sector, again, 80% of the antibiotics or the antimicrobials are used for prophylaxis. Can you understand? Prophylaxis. Antibiotics are being used for prophylaxis, which is very highly questionable. And definitely the rules had to be changed in order to ensure that that kind of situation is not going to happen in the future. You are the future. And, the life is yours going ahead. So you probably are the guys actually who had to come forward to ensure curtailing this kind of unnecessary usage, especially as a prophylactic or growth promotion within the animal sector. I would not go through this integrated system of antimicrobial stewardship. Whoever is interested, they can actually come over. We can discuss in detail about it. The dangerous bugs, I talked about the WHO priority pathogens, which are developing multi-drug resistance and now pan-drug resistance, and hence they are being defined as critical, high, and medium kind of, a list. And these are the indication actually for the drug manufacturers in order to understand what are the new inventions which are to come in order to take care of, these priority pathogens which are not getting treated by the existing arsenal of antibiotics or the antimicrobials. Some of these slides probably, I would not comment, so I would be skipping, so don't mind about it. One point, I would like to concentrate on this slide is, while antibiotic numbers means their inventions and also the number of products which are available for the medical community, the resistance is also equally going up. If you look at historically, 1940s was the penicillin, when everybody was happy that, we are able to treat and play the god, for the dying patients, just giving penicillin, and they are back into their life. And that probably took about 10 years to develop the resistance. But if you look at historically, from 60s to 70s onwards, every antibiotic, which is coming into circulation or into the market, that is getting the resistance within no time. Now, the last antibiotics, which we have seen coming was around 1990s and 2000s. Within 3 years, you have seen actually the resistance being developed. And there are very few new drugs which are coming for the reasons of commercial, because when you have such a short span of only 3 years available for marketing or selling, no pharmaceutical company is interested to invest into research and development and get the new drugs. That means, we are going to have a very, very bleak future, very dangerous future where we will not be able to treat even simple infections. That's why we need to invest seriously in preventing the infections. And, we had been talking about it, especially, it is good that, corona or the COVID-19 infection has kind of had a silver lining, that it put into the minds of the people how dangerous and how catastrophic the infections can be. I think, that is one lesson, which had to really reverberate in our minds and also in the government minds in order to invest more and more into preventing the infections, so that, all that what we have achieved in the modern medicine can go on, like, keeping the surgeries safer, keeping organ transplants safer, keeping dialysis safer or the cancer care safer, etc., etc. What are the key considerations for optimal use? We talked about it. We had to ensure that we had to target the priority pathogens. We had to have, we had to overcome, the resistance. We had to also ensure that infection prevention and control and the WASH, that is water, sanitation and health, is taken seriously. We had to ensure that, the antimicrobial stewardship is taken seriously, so that the optimal use is going to be put in place, and we preserve the effectiveness of that arsenal which is life-saving for the humanity. So this is the breaking, this is the slide which I usually use towards the end of my presentation to grab your attention once again, that antimicrobial resistance is a global problem, right? And it is in fact killing more people than oncology or some other diseases. When Ramkishanji was making a presentation, he talked about top 10 issues concerning the global health. One of them is antimicrobial resistance. If we don't stop it, world is going to pay a very high price. Already world is paying a high price. If you look at the Lancet publication, which has actually covered very extensively the 2019 patterns of AMR, where it has come out very clearly that more than 4.9 million people are already dying of antimicrobial resistance. And if you are not going to keep a stop, probably many more times this problem is going to increase and the mortality is going to increase. And not only the mortality, but also it is going to have a significant impact on the global economy, making the loss of trillions of dollars. So, broadly, I have covered most of the topics. I would come a little to our own scenario in India. When it comes to the global action plan, in order to handle the antimicrobial resistance, World Health Organization and the World Health Assembly in 2016 has brought out this global action plan on antimicrobial resistance after a detailed research and also the consensus of all the nations. And in this action plan, there are 5 major elements. One is the awareness, understanding, knowledge and evidence, infection prevention and control, optimal use, innovations, R&D, etc., etc. Taking that into consideration, India also has come out with its own plan in 2017, and we are currently working to map the stakeholders in Telangana in order to implement the state action plan. There are four states which are ahead of us, that is Kerala, Madhya Pradesh, Delhi, and the 4th state is our neighboring state, Andhra Pradesh. I hope with the stakeholders like IMA, the drug control, and all of you, we should be able to come out with this plan and ensure that we are not going to have this problem further escalated. Now you please tell me whether antibiotics are a hero or villains. Raise the hands, who think it is a hero. Absolutely, it all depends on us. We can make it as a villain or a hero, depending on, how we are going to make use of it. Be careful, ensure that, there is going to be optimal use in order to save our valuable lives of our patients, to save our healthcare, to ensure that the globe is going to be safer, and when there is a need, this arsenal of antibiotics are going to be on our side, not against us. Thank you very much for your attention.